My name is Mike Litrel. I'm a physician at Cherokee Women's Health Specialist, and I want to talk today about patient results that I've seen with the O-shot. The O-shot is a procedure that we do in the office that takes just about 5 minutes to perform and about 30 minutes total, where we inject platelet-rich plasma, growth factors from a patient's blood into the erogenous areas in a woman's genitalia to help with sexual satisfaction. It's very common that women experience a drop in their libido or sexual desire after they have children. So I had a patient that I saw yesterday who's in her early 30s. Her kids are 2 and 5, and she had such a drop in her sex drive that it was affecting her marriage. So after meeting with her a few times, trying different hormones and and noting a normal exam, we injected platelet-rich plasma about 3 or 4 months ago. And she returned yesterday, and she's delighted with the results. She has the fireworks back in her marriage, and she told me that she felt hope that that children didn't destroy the desire to be intimate with her husband. So with such an easy procedure to perform, technology that was not available a few short years ago, it's a lot of fun to be able to provide that for patients. So if you have questions or concerns, please let us teach you about the O-shot.